So we do get some of those challenging clients that have had some injury to their face, and we can always make it look more natural, kind of back to where it was with filler. Also, Botox too. If
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Amy Ingle, who has over 30 years of nursing and 20 years of aesthetics experience. She opened her medical spa practice 8 years ago with the intention of providing both men and women with the most advanced facial and body rejuvenation therapies. She received a master's degree in nursing with honors from South University in Savannah, Georgia, and is currently an advanced registered nurse practitioner licensed to practice in Florida with certification from the American Association of Nurse Practitioners. She's the founder and owner of 2 Sweet Spot Med Spa locations and trainer and owner of Med Aesthetics Academy, a concierge and VIP training program in the art of injectables and business startups and management. Her efforts have achieved top 50 in the nation for 3 years in Evolus sales in the field of medical spas and plastic surgeons, and has made the top provider for Revance RHA collection of fillers in the Southwest Florida area. So Amy, welcome and glad to have you here.
Thank you so much for having me on.
Yes, let's dive right into it. How did you first get interested in medicine?
When I was 3 years old, I used to pretend I was a nurse and I would bandage my dad's hand up or his leg and put band-aids on him. So that's kind of where it started. And then just as I got older, I was in high school, I took a basic CNA class and loved it, was in the hospital working as a nurse's aide. Then, after I graduated, as I was in college pursuing my nursing degree, I worked in the hospital on the side. So that's kind of where it all began.
Okay. And then how did you make that transition or that jump into aesthetics?
Well, I was a nurse for quite a while, decided to go back to school, get my nurse practitioner. I've always had an entrepreneur spirit. I owned a home health agency as an RN before I went back to school to get my master's. I also had a couple other businesses working with DME companies in durable medical equipment. So when I went back to school, I got my master's in nursing, became a nurse practitioner, and went into the hospital just to get that basic understanding of what it was like to be a nurse practitioner in today's world in the hospital. So as my foundation grew, I knew I wanted to do something on my own. I knew I wanted to have my own business. I knew I didn't want to have to work with insurance companies and Medicare because I did that in the home health agency. And so I thought, what better than aesthetics? It's cash pay, it's fun. Your clients come to you because they're well, not because they're sick and they want to be there.
Awesome. Well, I guess that's how a lot of people want to get into, especially when they make that transition from you, like work in the hospital to aesthetics. Almost all of them was like, I hated dealing with sick people all the time. I want to work where people are healthy and they just want to look good.
Right. Yeah. I mean, I worked in the hospital for years and took care of a lot of different kinds of patients, pediatrics, neonatal, ICUs. I think I've done almost everything except for flight nursing.
Oh, wow.
So I decided, it's time to kind of take a break from that side of medicine and go to the more exciting, fun aesthetics world.
Got it. So now that you have your practice, you've had it for I think 8 years, was it? Um, I won't really talk about the treatments that you provide. Like, what are some of the most common treatments that your clients and your patients come to you for?
Well, when I started 8 years ago, I just started out with Botox and fillers. Um, Worked with several different kinds of neurotoxins, Xeomin, Dysport, Botox. Some newer ones came out, Juvo and Daxxify. So now we have that in our spa as well. And that's probably one of the most sought after treatments in a medical spa is Botox type treatments. The second is dermal filler. So if someone were to come in and they feel like their face is falling, I hear that a lot. My face is falling. There's ways of plumping up the face to make it look more aesthetic pleasing and kind of turn back those years. So I would say that would be the number 2 sought after treatment that we do.
Okay. And I want to dive a little bit deeper into this, the Botox and filler. So I think Botox is almost like the gateway drug, if you will, into aesthetics.
Yes.
You talked a little bit about filler kind of plumping up the face, or even if people feel like their face is falling. But could you talk a little bit more about the differences? Like when it comes to Botox, what does Botox actually do?
Yeah, good question. Because a lot of people get this mixed up. They think they can get a Botox treatment for cheek filler type procedures. It doesn't work that way. So, what neurotoxins are is we use botulism. Toxin A is the main botulism out there in the market here in the US. There are some others that are being developed. There's also a B that is in the US, but it's for cervical dystonia, mainly not for aesthetics purposes. However, we do use it in some instances. But what it does is it actually, when you're injecting it into the muscles, so you would inject it into muscles that you want to paralyze. So when I have people ask me, I have cheek lines here. We can't inject in these muscles. These are your smile muscles. So we have to be really careful about how we teach and how we go over the treatment so they understand what expectations there are. So Botox, when it's injected into the muscle, like I said, it paralyzes the muscle where it blocks that acetylcholine junction, so it cannot contract. It lasts about 3 to 4 months. It kicks in anywhere between 2 and 7 days, and then it takes about 2 weeks for the product to actually absorb into the muscle and paralyze that muscle that you're treated. Some people can get longer than 3 to 4 months. Some people can get a little bit longer, like 6 months, but that's really rare. Some products on the market are quicker to work than others. So, we carry all five of the six FDA neurotoxins on the market because we do have clients that get used to their muscles just get used to the Botox or the ZMN, and we need to change them to a different product just so that it starts working better. Then when you go to the dermal fillers, what that is, it's hyaluronic acid. And when you're putting it into the area of where there's a volume loss, so at age 40, we start to lose a little volume right here. We can plump up those cheeks with hyaluronic acid. And that is actually a natural product that our body makes, but it is made and processed in a lab sterilely. So when we buy it, it comes in a syringe and we can inject it in those areas to give it a little more volume so that you look a little bit less saggy, a little more plump, and just kind of rested overall. It does not paralyze the muscle. We
Mm.
do not put it in the muscle. We just put it in areas where there's volume loss. So you've seen women get their lips done. We can do jaw lines. We can extend the chin. There's all kinds of neat things that we can do with filler to kind of sculpt the face. And my company that I have that I do trainings, I say it's the art of injectables because it really is an art.
Now, I want to go back to something you mentioned as far as the Botox side. You said Botox paralyzes, but isn't it when it comes to Botox, it's mostly for fixing wrinkles? So could you kind of clear that up as far as like, okay, well, you're paralyzing it, but I have wrinkles, so wouldn't you just keep the wrinkles in their paralyzed form?
Yeah. So can I put you on the spot?
Yeah, go ahead.
Okay. So what I would like for you to do for me is scrunch your brows together like you're mad and you barely have any wrinkles. Now raise your brows up. You have a couple little wrinkles here. So when you use your muscles and you contract them, as we get older, we lose collagen and elastin. And that is what we're seeing is that lack of collagen and elastin over time, where the muscles are still working great. It's just the skin does not bounce back and as well. And over time too, when people have the really deep lines in their forehead or between their eyes, which we call 11s, it can actually cause an indentation, which we call a static line. So when they're not frowning, that line is noticeable. And that's just years of frowning and just increasing that tissue. We can almost reverse that by doing a treatment here in the area. It may take about a year of treatments every 3 months, but if you train that muscle not to crease, that skin, that elastin can kind of fill back in, and then you can have a smoother appearance.
Okay, so as you're moving your muscles, if some are paralyzed, it's not going to cause the wrinkles. That's what Botox does.
Right, you're right. So what it's doing, it's not allowing that muscle to contract.
I
So
see.
if it can't contract, it can't crease the tissue
Got it.
and cause
Okay.
that wrinkle.
Makes
Yeah.
sense now because I think that was like the disconnect between okay, it paralyzes, but then like
Yeah.
it's freezing my wrinkles in place.
Right, right. Yeah. It's like all working underneath the tissue. And you have to be very careful who you go to because you can inject the wrong muscles and have a very bad reaction
Hmm.
result. So, for instance, if you get Botox in a muscle that holds the lid, the eyelid up, if you get some of that in that molar's muscle, it will drop your lid and then you'll have what's called a ptosis. And that's like, I call it the pirate. Arr. So you can treat it with some medication or and just let it wear off over time. So you have to be really careful who you go to because we do have to treat the muscles that need to be treated and leave the other muscles alone that are important, like the smile, the lid raising muscles, that kind of thing.
Okay. And you brought up another interesting point, which I don't think I've ever heard before, is that you want to sometimes switch the injectables that you're using, like if on Botox, switch into Xeomin or switch into something else. So I've never heard that before because, and it sounded kind of like if someone is getting like Botox over and over and over again, it sounds almost like their body gets used to it and they don't get the same effect. But if you switch them to another one, it's almost like they get the full effect of it. Did I understand that correctly?
Yeah, do see that, not in every case, but yes, we do see that, and that's correct. So I always tell my clients, use what works. Use what works. And then if you hit a wall and it's not working as well as it used to, let's just change it. Let's change it to a different product. Now, all the products are pretty much the same on the market. They're just made a little differently, except for one. One is Daxxify. That is one of the newer ones on the market. It's been out for about, I think, about 3 years now, and it is made with a protein, which is a little different from the others. So they have found that that product does work well and can last a little longer on some clients, patients. I don't see that as like the rule of thumb, but what I do find is my patients that work out a lot, that have a high metabolism, it does last longer for them. But that's the only one that's a little bit different than the other five on the market.
Okay, got it.
Yeah.
And then when it comes to combination treatments, so I mean a combination like, can someone get Botox and filler at the same time, or is it kind of like
Mhm.
do one at a time, or like what can you combine them?
Yeah, sure. Of course. Okay, so if we're doing, say, the mouth, if we're doing a filler in like the nasal labial line or the marionette lines, we can also put toxin there. We can also put Botox in a muscle down here to kind of soften, paralyze the muscle, not completely paralyze it, but weaken the muscle. Because we have these muscles right here that pull down, they're depressor muscles. And when they pull down, sometimes you get that marionette line that you see with older people. We can fill that in with filler, and then after we do the filler to fill in the lines, then we can put the Botox into that muscle and weaken that muscle, and then it's just out really nicely. It looks natural.
Okay, got it.
And we
And,
do that all in one appointment. Yes.
oh, okay, perfect.
Answer your question.
Now, you mentioned natural, which I think is a very big thing that people are starting to go in that direction. They want to look natural. So when it comes to the natural look, I think a lot of people have that perception that, oh, if I get Botox, if I get filler, I'm gonna be look overdone, I'm gonna look fake. So
Yes.
how do you balance between that, making it look natural, but you're still using Botox and filler?
Yeah, that's a really good question. I think that is one of the number one concerns when somebody walks into our spa, if they've never been there before, because they see some crazy things on TV. They see people that's been way overdone. They'll go shopping and see someone with a full face, so you know they've had filler or, just way too much. You've also seen those funny little videos of people getting Botox and their eyebrows are all funny. I mean, all that can happen. So one of the things that we all stress in the spa, there's seven of us, and we like to stress that natural is more important than trying to look good. So it can be overdone for sure. I always recommend to my clients, especially if they're brand new clients. I do this for all my new clients that walk in the door. If they come in and they want some work done, I'll go through a consult with them and I'll say, let's do this, 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 this. Now, what bothers you the most? And we can start there. We don't have to do everything in one treatment, one day. And then also, too, some people, when they come in, they do have a lot of volume loss here. I never put two syringes in at once for a new client. Never, never. I learned my lesson. I had a client that needed it. She really did need it, but there was so much swelling that she went home and she was horrified all night until the swelling went down.
Mhm.
And so even though it looked great afterwards, the trauma, it just was too much. So I always recommend let's start with one syringe. We'll split it in half. We'll do one on each side. I'd like for you to just wait a week or two, see how the swelling goes down, see how everything kind of settles in. And then if you want to come back and get more, let's do it. So I always say go low and slow because that is, you just get more of a client that trusts you when you don't try to push the products on them.
Got it. And also,
Yeah.
I'll dive into as far as quality of product. Now, you mentioned that as far as the injectables go, you have the 5 out of 6 FDA approved ones. But I'm sure you've also heard stories, horror stories of people out there that use off-brand, off-label,
Yeah.
questionable quality. So, is
Yes.
it something that people, your average consumer, should be concerned about? Uh, is the provider going to providing a good quality of product?
Right. Yes, that is really important because if you are going to a place that you're not sure where they get their products, you don't know the name of the product, that should be concerning. They should be advertising what they're using. If they're not advertising the product they're using, I'd be very beware. Because if I'm carrying Botox, or say that I get Botox from the dark market, right? Made by somebody down in the Antarctic, whatever. I'm not going to be able to advertise Botox because Botox Allergan's going to know that I don't buy that product and they're going to find me. So if you notice that spas are not advertising the products that they're using, then stay away, stay away. Also, it's really good to see if your injectors that you go see are involved in rewards programs with those products because you have to be a buyer of that product to be able to give rewards to your clients. So, for instance, again, if someone buys on the black market, they go in, you get a Botox injection, and they don't have the alley rewards that Allergan allows you to have if you receive Botox, then that is kind of a red flag. Either A, they're not buying real Botox, or B, they haven't done the procedures enough to be able to qualify to offer that reward.
Mm,
And almost all the products on the market have rewards. There's a couple that don't, but most of the products that are on the market offer rewards. So, for instance, you go in and you get 20 units of Botox, you get 200 points, which is just like a $20 gift certificate that you can use at your next appointment. So that's another little tip to see if you're going to a reputable place.
okay. And what are some other kind of red flags that you see? Maybe not necessarily just on the quality, but like just in general, like if someone's looking to find a good provider that can take care of them, what are some of the things they should keep an eye out for, either good or red flag, kind of like you mentioned a few already?
Yeah, yeah. I think going on Google and looking at reviews is simple, it's easy, it's right there at your fingertips. That's a great place to start. See what everybody's saying. Now, you're not going to have 100%. I love this spa if they've had a ton of reviews. There's going to be one or two that their expectations were not 100%. And that's okay. But if the majority is like, I had great results, looks good. Also, look at the website. That's another thing. If they don't have a website for their business, that's a big red flag. And
Mhm.
also social media. I do not like doing social media, but it's something I have to do because people go on there to see your work. So go on social media, go on the website and look at the before and afters. They could be AI. I have seen some of those. So you just have to be very aware. Um, just also ask your friends or ask people around the community if they've ever been there and what they know about it. So I think too, make sure they're licensed. You can always look it up. You can always go on like the state website and look up licenses to see if they are active and if they, are in good standing. I think that's important.
Okay. Now, going back to the Botox and filler, what are some of the most common misconceptions or myths you hear about that? We talked a little bit about those as far as like the overdone look, but what are some
Yeah.
other myths or misconceptions you hear often?
Yeah. So one of the misconceptions I hear is, oh my goodness, I've been doing Botox now every 3 to 4 months for 5 years. This is a client said this to me. I stopped doing it and I've been not getting my Botox like I usually do for the last year, and my face looks worse.
Mm.
I hear that once in a while. And so, yes, you're going to not be pleased with your face because you have taken care of the wrinkles by, going in and getting those treatments every 3 to 4 months. We age every day. We cannot stop that. But if you do maintenance of, say, Botox every 3 to 4 months, you're going to kind of slow down the aging process. If you stop it and you don't do anything for a year or two, yeah, it's going to look like it made it worse because you're so used to your face being treated. So I
Oh,
always say it's not going to make it worse just by getting Botox. I've even heard, oh, I used to get 20 units, now I get 40. Oh my goodness, it's going to make my face worse. It's not. As we get older, we do need more units.
right.
Yeah. So, because we lose that elasticity and that collagen that I talked about earlier.
So it's more perception. It's not the reality. It's more they just perceive that it's getting worse because
Exactly. Exactly.
got it. Now, Amy, I'm curious, as far as when it comes to artistry, how important do you think it is to have that artistic eye in what you do, how you approach your client and your patient care? Because I think when people think about medicine, that artistry is not the first word that comes to mind, but I think in aesthetics, it's different. But I'm curious, like, what are your thoughts on the role of artistry in what you do?
Yeah, I think it's really important to have a good foundation of what is natural, normal, and also to know the elements of the golden rule. We call it the golden rule. So, the eyes are this far apart on certain ethnic clients, and the nose is angled this way. And there's just a lot of math involved, which you wouldn't think, in how the face is developed. Everybody's different, and we are all unsymmetric. I don't care what anyone says, nobody is completely 100% symmetric on both sides. Even when I go in and I do injections, I can tell who sleeps on what side of their face. I'll go in, I'll say, oh, you sleep on your right side. And probably 9 times out of 10, they'll say yes. Or they'll say, no, I sleep on both sides. And so I'll say, well, what side do you wake up on? And so it'll be the side I pick because I can just tell, lifestyle plays a huge part in how our bodies react and how we develop. So, it's really important to know the facial features, the golden rules of what I say. Now, for instance, when I talk about the golden rule, there is a golden rule with the lips. That is the top lip is 1/3, and the bottom lips needs to be 2/3. So think about that. That is the golden rule. That is the natural, aesthetic, pleasing lip. Now, Hollywood, what do? They do 1 to 1,
Uh,
right?
yeah.
You see a lot of Hollywood actresses, and they like to have those big plump lips that are 1 to 1, and that's kind of a phase. But when I have clients come in, especially older clients over the age of 40, 50, I'm gonna always suggest I do the golden rule with them because we want it to look natural and not unnatural, especially as you get older.
Mm. Got it. Okay. And then, Amy, I'm sure that throughout your experience, you've had some tough cases that have walked through your door. Is there maybe one story that you can share that really stands out in your mind of just a tough or challenging case that, and how you were able to get them a good outcome in the end?
Yeah, sometimes we get clients that have they've had childhood deformities that were corrected by surgery. We've had some clients that have been bitten by dogs or have had skin cancer and have had to have Mohs surgery. So we do get some of those challenging clients that have had some injury to their face. And we can always make it look more natural, kind of back to where it was with filler. Also, Botox too. If we have some asymmetry with muscles, we can correct that. I have a lot of clients that have had Bell's palsy, and so one side of their face is a little bit droopier than the other. And they had Bell's palsy like 20 years ago, but they still have this effect. And I've corrected some of that asymmetry with Botox. I did have a client that had a couple of skin cancers around her lip, and she had a huge chunk taken out through surgery. And so I do her lips every year and just give her a little bit of a pout and a little bit of lip lining with the filler. And it just really helps with her self-esteem and just overall wellness.
Mhm. I'm really glad you brought those examples because I think when people think about the aesthetic industry, it's all about vanity, it's about just trying to maximize your beauty. But when you talk about the stories that really stick in your mind, it's the ones where people had something that either through accident or through birth, some type of deformity or some type of issue. And it's really not about just maximizing beauty. It's about they just want to feel like their best self. They just want to get back to normal. And I think
Right.
that's something that people don't think about enough in the aesthetic industry. It's like, hey, how can I just be the best version of myself? Or how can you get someone who does not feel normal, who feels out of place, getting them to feel normal again?
Right. Yes. And that's probably the most satisfying part of the job. I've been a nurse for 30 years and that's what I do is help people, help them feel better. And if you're not in the aesthetic world, you may just think it's just all vanity, like you said. But there's so much more to it than that. There's emotional feelings. I've had clients come in and cry about certain things that they feel insecure about with their face or their body. And just by being there to kind of help lift them up and give them some hope is really rewarding.
Mm-hmm. Now, Amy, where do you think the future of aesthetics is going?
It's going. It's just gonna keep going. Um, it's funny. So I think right now regenerative medicine is a big buzzword. Exosomes, platelets, Wharton's jelly, stem cells. That is really just going crazy right now. Um, we can also mix that with filler. Like I can mix PRP, platelet-rich plasma, with filler and stimulate your own cells to regenerate as I also plump. So I think it's just gonna keep getting better and better. They keep finding new and new ways of improving and more natural ways too to help stimulate collagen and elastin.
Okay, so talking about that regenerative medicine, I want to take a step back there. What is, in nutshell, for people who don't know, what is regenerative medicine? I guess what's the best benefits of regenerative medicine?
Right. Well, regenerative medicine really started with orthopedics like 20, 30 years ago. I could tell you like the NFL, they're really big into regenerative medicine. What that is if you have like a tear, like a muscle tear or some kind of injury, just by taking your own platelets and injecting them into the joints, stimulates all these growth factors that really help to heal those injured areas far more than like a steroid injection. That just is an anti-inflammatory. It doesn't heal. Regenerative medicine is actually healing that tissue and actually it expedites the healing far faster than if you were not to use regenerative medicine such as PRP. Um, you can take exosomes. This is kind of a new thing, and put on top of your skin, and it's an anti-inflammatory, but it helps to also tell your little cells to like either grow up and get real or get out of here. You need to like get out of the body because you're just causing harm to the rest of the tissue. So these little exosomes are little signals that tell you do this, do that. And that is kind of, the big thing right now. Everyone's using exosomes. I have to say my favorite, though, is Wharton's jelly. I use that for my regenerative medicine. I do P shots, O shots, hair restoration, and some other things, facial injections. And Wharton's jelly are stem cells basically from umbilical cords from newborns.
Hmm.
And they're little mesenchymal cells that will go to the tissue wherever you implant it by injection and will actually stimulate. So it can help heal blood vessels. It can help regenerate collagen and elastin. There's all kinds of things that you can do with some of the regenerative medicine right now. And it's just blowing up. I just think it's going to be the next big thing as far as what's in aesthetics.
Sounds like it's almost the first step to immortality.
Right, right.
Okay, well,
Yes.
I mean, I'm curious, when it comes to your practice specifically, what is your vision for Sweet Spot Med Spa?
My vision has always been from the get-go to help people feel better about themselves by giving them options, giving them hope, and doing natural treatments to help slow that aging process and just to look good and just feel good. That's really my vision. I have two locations. I've had three at one time. We've had some hurricanes. I've lost a building. There's been all kinds of crazy things that's happened in the last 8 years. But as far as going forward, I just enjoy having my two locations, helping others through my training program. So I train other injectors, such as doctors, dentists, nurse practitioners, PAs. So I do that on the side as well. And then I have my new podcast that's going to be starting in the next week, Glow Up and Get Real. And what that is about is just sharing my experiences, like we're talking about, and talking about real experiences in the spa, what can go wrong, what success stories I've seen. And this is for both injectors and for patients.
Got it. Well, Amy, I have one last question for you, but before I ask it,
Okay.
I do want to point people to your website at sweetspotmetaspa.com.
Yes, I
Well,
appreciate that.
pleasure. My last question for you is, what does beauty mean to you?
I would say beauty isn't just the outside, but it's also the inside. Beauty is a whole package deal. And I think that when someone feels beauty, they feel at peace, they feel empowered, and they just feel like they, are on top of the world. Beauty, again, it's not just what I see, but it's what I feel.
Awesome. Well, there you have it, Amy sharing her expertise. Now, where
Thank
can people contact you in your practice?
Yeah, so again, on the website, sweetspotmedispa.com, we're also on Instagram and Facebook. I have a link tree in the bio in Instagram, and it has all of my sites on there. So you can get me from all angles. I'm also the Sweet Face Injector. So yeah, that would probably be the best place to start.
Okay. Well, Amy, thank you. This is great. Thank you for shedding some light on these topics. I'm sure that some people had some confusion, and your expertise was invaluable. So thank you for coming on and sharing your message.
Oh, my pleasure. Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.